Hi everyone, Whitney Lowe here from the Academy of Clinical Massage with another of our Clinical Insights videos. Today we're going to be talking about the second most common upper extremity nerve entrapment problem. Everybody has probably heard of carpal tunnel syndrome being, of course, the most common, but the second most common one is actually not recognized as often as you might think. It's a condition called cubital tunnel syndrome, and this is an entrapment of the ulnar nerve on the backside or posterior aspect of the elbow. So let's take a look at what happens in ulnar nerve entrapment in cubital tunnel syndrome. So let's start off first by looking at the relevant anatomy in this area. In particular, we want to look at the pathway of the ulnar nerve and what makes it vulnerable to compression in this region. Here we've got an image of the ulnar nerve. Actually, this is the three main nerves that go down the upper extremity, and we're going to zero in on the ulnar nerve here. So let's just highlight that nerve and we'll isolate it and take a look at what that ulnar nerve looks like. Here it is by itself, and then let's isolate it. We can see the pathway of the ulnar nerve coming in from the brachial plexus and then dividing into the different portions of the brachial plexus. It'll course down the back side of the humerus, and then right here is the region that we're primarily concerned with as it goes around the posterior aspect of the elbow. This is the region right here where the cubital tunnel is. So this is where that ulnar nerve gets entrapped. Now it's very superficial here, and you've probably banged your funny bone, that phrase that we use when we hit that ulnar nerve with a sudden impact force, and then you get this pins and needles shocking sensation down your upper extremity. That's because that ulnar nerve, you can see it's right up against the bones there, so it's pretty easy to compress that nerve against bone. Now let's look at what actually makes the cubital tunnel itself. Now, if we look at the posterior side of the forearm, we can see here's the main flexor muscles. This is the common flexor tendons up here, and these are the flexor muscles of the wrist and fingers. And let's zero in on those a little bit. We can see this one, this most superficial muscle right here is the flexor carpi ulnaris muscle. And you can see it has two main heads of attachment in the proximal region here, one on the ulna and one on the humerus. And the two separate heads form this tunnel, and the ulnar nerve travels and right through that tunnel, and that's where it is susceptible to compression in cubital tunnel syndrome. So we call this the cubital tunnel. This is the tunnel constructed by the two heads of that flexor carpi ulnaris muscle. So what is it that's likely to compress that nerve in the cubital tunnel? There's actually several factors that are relatively common. One, as you might guess, is just impact trauma on the back side of the elbow. Now, an impact trauma on the back side of the elbow is really going to be something that's going to be more of an acute injury. This is the one like banging your funny bone. But you might have more of a chronic compression in there from leaning on your elbows. Let's say maybe you have a workstation where you're leaning forward and you're resting your elbows on a table. That's a long-term compression of that nerve in the cubital tunnel, and that could likely lead to the symptoms of cubital tunnel syndrome. So it could be a sudden onset injury, but more commonly we see this with chronic compression in there. That chronic compression could also occur because there might be scar tissue or maybe short, small tendinous bands within the flexor carpi ulnaris muscle that are pinning and entrapping that nerve in the cubital tunnel. The other thing that might lead to this is long periods of some kind of activity where the elbow is held in flexion. For example, a waiter carrying a tray is holding their arm in flexion while they're maintaining significant upper extremity workloads. If you have to do some kind of work activity over and over again and hold the elbow in flexion, that nerve gets sort of bowstrung against the underside of the elbow, the back side of the elbow. Let's take a quick look at what that would look like. Here we'll just zero in on the biceps brachii muscle because it's one of the main elbow flexors. But if that nerve was present, the nerve is going to be coming down the back side of the arm, and then it's going to go around here and then course down into the hand. If we turn our friend around like this, you can see here's where that nerve would get sort of pinched and compressed against the back side of these bones when it's pulled taut by the elbow being in a flexed position. So this flexed position of the elbow over long periods of time is a very common cause of cubital tunnel syndrome. So let's look at some of the most common signs and symptoms of cubital tunnel syndrome. The ulnar nerve is a mixed motor and sensory nerve, which means it has motor fibers in there and sensory fibers. It does have a pretty large percentage of sensory fibers, and they go all the way down into the hand and innervate this portion of the hand right here. So if a person is reporting their symptoms being present in this region of the hand, mainly last finger and a little bit of the ring finger here, and this edge, the ulnar edge of the hand, that's the cutaneous distribution of the ulnar nerve. Keep in mind, many people will say that they have nerve symptoms down in their hand, but they actually report them across the major part of the palm here, which is the median nerve innervation, and that's more likely to be something like carpal tunnel syndrome. Cubital tunnel syndrome produces its sensations in the ulnar nerve distribution in the hand. Now, there are also motor fibers in the ulnar nerve, and they may also affect muscles in the hand, in particular the adductor pollicis muscle, which is over here on the thumb. Sometimes you'll see some degree of atrophy in there, or there will be a demonstrated degree of weakness in gripping with that thumb muscle not being very strong if there's compression on the ulnar nerve, and that's going to impair motor signals to the adductor pollicis muscle. Now, from a soft tissue or massage therapy aspect, our focus is really on getting pressure off that nerve. The main way you want to treat almost any nerve compression problem is really focusing in on getting the pressure off the nerve. So in this instance, pressure might be caused by excessive tightness in the flexor carpi ulnaris muscle. So a lot of our treatment techniques are going to focus on that muscle. So let's zero in and look at that just a little bit. Again, because of the conjoined tendons of all these flexor muscles, we're going to focus on all these muscles in here on the medial side of the forearm, the flexor group, and in particular working on that flexor carpi ulnaris muscle right here, trying to reduce tightness in that muscle. Now, do be cautious that if anything that you're doing while working on those muscles increases the neurological sensations that the person is feeling, that means we want to get off that area because we do not want to increase any compression forces that are increasing those neurological symptoms. One of the key things to remember in massage treatment of nerve compression problems is these things tend to be relatively slow healing. So don't be disturbed if you don't get immediate results here. This takes a while sometimes for this to be making a significant change. It's also real important that the person engages in some type of activities at home that will help support the things they're doing. Removing any offending activities that are likely to have led to this is going to be critical as well. Another treatment strategy that's often used is something called nerve mobilization techniques, or neurodynamics, are also referred to as nerve flossing. The idea with these procedures is we're trying to get that nerve to increase its mobility as much as possible, and we'll bring the nerve out into a position that will help stretch and pull the nerve fully and try to make it as mobile in relation to adjacent tissues as possible. We'll do another video sometime showing these neural mobilization techniques and what are some of the best strategies and ways to use them. There's different types of nerve mobilization techniques, mainly called tensioners and sliders. And in a tensioner technique, the goal is to try to get that nerve as sort of pulled taut and see if you can find an area where it might be sort of irritated from that tension position. The slider technique is more designed to increase mobility between the nerve and adjacent tissues. So it slides the nerve in one direction and then it slides it in another direction. We'll get into looking into those neural mobilization or nerve flossing techniques in another video. So as a key recap, we're looking at the second most common upper extremity nerve entrapment problem, and that is cubital tunnel syndrome affecting the ulnar nerve in the upper extremity in the posterior elbow region. This is definitely something that can be beneficially treated with massage, and it's very helpful as a massage practitioner for you to know a bit more about how this condition occurs and what are some of the key signs and symptoms so you can identify it properly and choose a more appropriate treatment strategy for it as well. If you'd like to learn more about these kinds of problems with upper extremity nerve disorders or numerous problems that we might address in the upper extremity, come on over and join us in our orthopedic medical massage courses at the academyofclinicalmassage.com. We'd love to have you come join us over there. And while you're at it, please be sure to comment on the video and subscribe to our channel so you can keep up with other things that are happening as we give you a lot of other helpful and valuable clinical information that'll be great to make you a much more successful practitioner in your practice helping people out of pain and injury conditions. We'll see you in the next video.